U.S. Surgeon General wants to include a cancer risk warning on alcohol, somewhat similar to labels now found on cigarettes. It comes as an increasing amount of research has linked drinking to different types of cancer. Dr. Amir Gambarewala is a breast surgical oncologist with Advocate Healthcare. Thanks for being with us to try to kind of sort through all this. We've seen studies for years that claim a moderate amount of drinking could help prevent things like heart attacks and strokes. So I'm sure you can understand the confusion now that they're talking about putting a Surgeon General's warning saying, no, even moderate drinking could contribute to cancer risk.
Yeah, absolutely. And I think that really helps to signify the importance of this message is that while the cardiovascular, I'll let my cardiovascular colleagues go over that information. For us in the cancer realm, for many years, for decades actually, we've been researching the impacts that alcohol has had on cancer. And it's pretty remarkable as to the effects it has directly on cancer and the increased risk that we have with alcohol consumption.
Yeah, the Surgeon General said alcohol directly contributes to about 100,000 cancer cases. What specific types of cancer can be connected to alcohol consumption?
So for right now, and the research is still ongoing, but what we've determined, it used to be thought to just be head and neck cancers, but now we've realized it's even the more common cancer. So you got head and neck, then you have esophagus, you have breast, which is my area of expertise, liver, and then colorectal cancer as well. The pancreas is probably up and coming as well. That's kind of the next probably increased cancer risk that will come through.
But we hear so often on the news, one day something's good for you or at least helpful or not hurtful, and the next day, oh no, it could pose a cancer risk. I guess what's your best advice for people who are looking to minimize their cancer risk?
Yeah, I think that when it comes to specifically alcohol, there hasn't been a ton of controversy in its cancer risk. As we develop and understand more and more about cancer, we can help decide what is and what isn't. There's years that smoking was thought to be, I don't think anyone was actually promoting it. And same with alcohol. Actually, in 2020, the federal government actually came out with some dietary restrictions that mentioned that there's no real reason to start drinking. And on those similar lines, what can we do about cancer in general and cancer risk reduction? Here at Advocate, we've actually started these regional, both in Illinois and Wisconsin, breast cancer prevention clinics. And what we advise people is, exercise, number one, achieving a healthy body weight, additionally, reduction in smoking, avoiding and limiting alcohol, and vitamin D are like simple lifestyle changes that people can make to help reduce their chance of many cancers and specifically breast cancer.
Dr. Amir Gambarewala, thank you so much. We appreciate when an expert like yourself can join us and kind of sort through some of this complicated medical information. We'll post more on our website, WGNTV.com. Have a great weekend.
Thank you so much.